Hello, my dog lovers. Good morning. This time, we are here with Alicia. Hi, Alicia.
Good morning from Vancouver and hello, Prague.
Yes, I'm in Prague visiting my family and my mom. Even though it has been a little challenging because of COVID and they closed her senior center, so we can't really see her right now. But we hope we'll be able to see her next week or so. Again. Anyway, I'm so glad to connect with you. I have a really interesting topic. I always enjoy preparing because it's almost like going back to school and refreshing everything and making sure that I pass on information that is helpful and that you'll be able to use and keep your dog healthy and prevent problems. So today we are going to be talking about urinary crystals and stones and how to treat them, how to prevent them, and how to make the best decision for your dog. Now, you're probably sitting here either that he stumbled upon this webinar or he saw some of our little announcements yesterday. And either of it is really good because crystals, urinary crystals and urinary stones can happen to any dogs and also any humans. So it's good to understand why they create, what you can do about it. And today we definitely focus on dogs, even though I think that it will be applicable to humans with in a greater scope. All right, so why do urinary stones happen? It's a good question. There are many, many different factors playing a role. And most of you already know that there may be some breeds that are predisposed to urinary stones and crystals. But the question that I would like you to ask is, why do some dogs of a particular breed do have crystal problems and others don't? And they may have even the same genes and genetic information. And indeed, genes do play a role. And when you think of genetics, we can't really change what our dogs came with unless we clone another dog and remove some genes and cut them with the CRISPR, which is the technology of cutting DNA and pieces and removing the genes. We can't really do anything with the dog that you're with now. So if your dog has urinary stones or crystals, I would like you to kind of settle for the fact that whatever genes he or she came with are given, and there's nothing that you can do. The good news is, though, that there is much that you can do about other aspects of this particular problem. You know, some of you may have not heard that genes are responsible only for about 15% of their expression. Meaning that if you have a genetic predisposition to a certain condition, whether it's chronic disease or even cancer, genes will not express. The likelihood that genes will express is about 15%. And many other factors play a role, whether it's your internal environment, the body environment of your dog, or external environment, whether it's stress, weather, climate, sun rays, food, all those play a role. So if you know of your family member having genetically predisposed condition, it does not necessarily mean that if you address your health in the best possible way that you'll get the problem. Sorry, I have to close the window. There's a construction next door, and of course they start making noise. Always there's some sort of surprises. This morning, by the way, I was preparing and our internet wasn't working very well. So we had the internet person here. So my slideshow is a little sparse, but the information is dense. So don't worry. Anyway, going back. So if there's a genetic predisposition to a certain condition, you don't need to kind of surrender to the fact that sooner or later you'll get a particular problem or your dog will have a problem. That is not true. And that is the area that we'll be working with today, and we'll be kind of discussing mainly. So the external conditions that need to be fulfilled for the genes to express is called epigenetics, or it kind of is in the area of epigenetics. And it's basically everything else but the genes. When it comes to urinary stones and crystals, there's also another really interesting factor that you may not know, and that is urinary tract infections. Believe it or not, bacteria can change the environment of the bladder and the urine to the point where crystals and stones will start forming. So that's another really interesting area. If your dog has predisposition to urinary tract infections, that may predispose them. Interestingly enough, even incisions in the bladder or in the urinary tract and surgeries can also predispose them to urinary stones. If there's any roughness or uneven surface of the bladder, that can predispose them to infections and also stones. Poor hydration. You know, I carry my water bottle on dog walks most of the time. When I forget, I feel terribly guilty, because I know that my dog's hydration is essential for them to actually be well. So I carry my little Hydro Flask bottle. I don't have it here. I will show you. I never use plastic bottles because they have estrogen-like substances. And it's good to have filtered water, but not necessarily distilled water. And I'll talk about it a little later. So hydration is super important. And if your dog is dehydrated, then the urine is more concentrated. And similar to our school experiments when we were in the elementary school and we tried to crystallize salt, their urine will also crystallize. Now, the crystallization of urine actually leads often to misdiagnosis, because when you take your dog's urine to the veterinary clinic and your vet will send it to the lab and store the urine in the fridge and so on, sometimes it actually can crystallize in vitro, meaning in the glass of the tube. And your dog's urine is fine, but it just crystallizes on the way. So I always caution people and say, if your vet diagnoses your dog with crystals or suspects stones because they're crystals, ask your vet that you will come to the hospital, collect urine right there, or they will collect urine in a female dog if your dog doesn't want to pee right there, and examine the urine right in the hospital lab or the clinic lab. And that will give you a better idea than sending the urine sample to the lab again. I'm not saying that sending the sample to the lab is wrong, but for elimination or preventing misdiagnosis, this is super important. So if one sample comes back with crystals, you have to collect urine sample at the clinic and analyze it right there. The number of misdiagnoses that I've seen in the course of my work, in the 30 years of my work, has been really large. And so what I usually do if people come from a different clinic and they say, you know, my dog is crystals and I want to address it naturally, holistically, the first thing that I do is collect the sample, analyze it, and see that there's actually no problem, right? So that's a really good news. But if your vet doesn't suggest that, you may want to suggest that. Make a little note. Okay. What else? Poor hydration is actually very closely connected with kibble. Kibble is one of the major reasons why dogs get dehydrated, because it's about 10 times as dense. It has about 10 times as much water. Sometimes the English terms get me. So kibble dehydrates your dog. And if you do feed kibble, and I know some of you do, I always suggest to try the switch if you can. Today in the park this morning, I talked to a lady who had a beautiful Aussie, and the Aussie was a little chunky, and we started talking, and she was saying, I know, she's a little chubby. And I said, you know, like, maybe you want to try raw or cooked food. He said, but it's so inconvenient, and I have 2 kids, and I understand those reasons. They're real reasons, real life reasons. But if your dog has crystals especially, kibble is really not a good idea. I don't know one single human doctor who would say processed food is better for you people. So why do we still actually have this debate? Why is it still going on in veterinary medicine? Some of you may know and guess why. I'm not going to get into the reasons. You can maybe type them in the discussion or something. Anyway, kibble is not ideal. Now, mineral excess or deficiency. Now, this is a really interesting one because there's about 37,000 billion chemical reactions happening in the body. I repeat this almost every single webinar that I have, but it's super important because all these different reactions that happen per second, and that's 37 with 21 zeros, have to happen with the chemistry of the body. They have to use proteins and omega-3s and minerals and vitamins. The body needs to use that to actually function. And if there's excess or deficiency, the body will start managing the different minerals and nutrients quite differently. And it can actually lead to metabolic disturbances. It can lead to liver weakness, organ dysfunction, cell dysfunction. And as a result, there will possibly be crystal and stone formation. Now, it's almost impossible to analyze and dissect one single factor that plays a role in crystal and stone formation. It's always multifactorial. It starts with the genetic predisposition and all the other factors kind of build on, and then suddenly you have a dog with a big stone. And then you have to deal with it, and then you're upset. Maybe not you, but others. I use the word you, and I shouldn't probably. Anyway, so mineral excess or deficiency, sometimes people think, well, if my dog has excess calcium or magnesium or phosphorus, that may create crystals. But sometimes actually the deficiency can also lead to crystal formation. There are some foods rich in oxalates, and I'll list them on my little, I have a little list later that I'll show you, and I'll tell you about the foods rich in calcium oxalate, which is one of the minerals that deposit in stones and crystals. So as I said, even other nutrient deficiencies are really important. The body needs the building blocks. We understand that we cannot build furniture without the wood and the nails and the screws. We understand that we cannot build bikes and cars. And we also understand that plants cannot grow without nutrients. And somehow we assume or maybe forget that our body cannot thrive without the nutrients. I've done many, many experiments in quotes on myself. And I also have seen the results of proper nutrient supplementation in practice. And it is mind-blowing how many dogs just completely recover when you feed them with all the nutrients, the building blocks that they need. It's like, it's mind-blowing. And at the same time, it's a little boring because, it's like repetition of the same principles and apply them to different areas of your dog's health. So that's really, it's important to keep it in mind. Now, I'm going to show you some of the types of crystals because they're kind of, they're interesting. I have found a little drawing of the crystals, so that they're not exactly what they look, but I have some little notes about what breeds they affect, and you can always look them up online. Everything is online these days. So this is just for your information. So there are several different types of stones. There are even more than I listed, but I listed the main ones. So there's phosphate stones, oxalate stones, urate stones, and then there are cysteine stones and struvite stones. I'm going to start with struvite stones because they're actually quite common and frequent in dogs. And they usually happen in alkaline urine. Now, alkaline urine is a predisposing factor, meaning that the pH is higher. There's acidic and alkaline. Alkaline urine is more likely to happen when you have a dog on plant-based diet or kibble. And that is why we see dogs on kibble actually being more prone to crystals and struvite stones. There's also genetic predisposition. Miniature schnauzers, Bichon Frises, and Cocker Spaniels may be more prone to this condition. Now, the cysteine stones, they refer, or they're they are a result of reabsorption of cysteine, which is obviously a crystal forming substance, reabsorption in the kidney. So there is some sort of kidney deficiency or kidney abnormality that actually leads to this particular problem. Now, if you look at the breeds that this particular condition affects, it's bulldogs, dachshunds, basset hounds, chihuahuas, Yorkshire terriers, Irish terriers, and Newfoundland dogs. So that's another stone. And if you have any of these breeds, you know what crystals to look for, but it does not necessarily mean that the other crystals will not, cannot be found. Oxalate crystals are nasty, nasty, nasty. They're the ones in the middle here. And they are nasty because they can be sometimes very spiky and sharp, and they're very painful if they get stuck in the urethra or somewhere in the ureter, which is the tube that goes from the kidneys to the bladder. It affects Schnauzers, Lhasa Apsos, Yorkshires again, miniature poodles, Shih Tzus, and Bichon Frise. So you can see that some breeds actually repeat in those lists. And if you are choosing a dog and you love any of these breeds, you have to be really mindful and very careful about really making sure that your dog is hydrated, making sure that your dog is not on kibble, making sure that you actually pay attention to regular urinalysis, and taking your dog's pee in the lab. All those are important preventive kind of steps and measures. The other stones are urate. And urate stones are actually very common in Dalmatians, especially male Dalmatians. And interestingly enough, the condition results from, it's a genetically predisposed condition, and it is a result of the liver being somehow dysfunctional and not metabolizing urate into other substances. So you can see that sometimes supporting your dog's liver in crystal formation is actually super, super important. And again, not all Dalmatians will have urate stones, meaning that you can actually prevent them by addressing the epigenetics of the possible of your dog, the external and internal environment of your dog. The genes are given, but the internal and external environment can be adjusted, if it makes sense. So those are the stones. I would like to show you microscopic examples of them. So you kind of get of oxalate and struvite. I know that it would be really boring if I start showing all the different crystals. Who wants to do that? I actually didn't really like this kind of topic at school because it's kind of boring, but the crystals are pretty, pretty, pretty. And the nastiest are the prettiest. It just, it's a little irony, actually. So on the right, there are calcium oxalate. You can see that they're cubic crystals. And the struvites are a little more...
Sorry to interrupt, Dr. Dobias. The slideshow isn't appearing on screen right now for some reason.
No!
Yeah.
Oh my goodness.
But it has been, and it's been amazing. Excellent.
Okay.
We can see it now. Thank you.
Okay, so you can see the beautiful ones on the right. They're cubic crystals, calcium oxalate. They can actually form really sharp stones. But stones of calcium oxalate can be also smooth, or they can be bumpy. They can be all sorts of different kinds. Struvite crystals, it's triple phosphate mineral. They are like little coffins, you can see. And they affect cats a lot. We're not talking cats today. This morning, someone asked me, are you going to talk about crystals in cats? I won't. There are many people who can talk about crystals and cats, and I just work with dogs, so I try to focus. But these are the type of crystals that affect both cats and dogs. So those are the images, and here are the foods high in oxalate. I know that you wanted to probably take a screenshot or write it quickly down. Parsley, spinach, chard, beets, nuts, berries, and beans. Oops. Now, this is the fun part. I'd like to talk about prevention. And as I said, preventive steps can cannot include genetics or genes, unless you're a genetic engineer and can manufacture another dog, and still will not help your current dog. And I wouldn't really like a clone dog, I think. So the epigenetic factors are the ones that you want to address. Infections, how to address infections, I'll talk about it later. Diet, nutrient excess or deficiency, stress, and also your dog's microbiome. And I didn't put that down, but also dog's liver and liver function. So those are really important ones. The only thing you can do is to optimize your dog's liver function, urinary tract function, and general health and hydration. Okay, so that's the area that we'll be working in. As I said, water intake is super important, but it is also important what kind of water you give. I've seen some people giving distilled water. Strangely enough, in my vet school, we learned that distilled water is basically toxic to humans and dogs because it dehydrates us. No, not dehydrates us, it eliminates, leaches minerals out of the body. And it can, if you drank just distilled water without any other minerals, you would actually end up probably with a lot of depletion deficiencies, and so your dog. When it comes to filtration systems, I do recommend filters, but I usually recommend 2 or 3 step carbon filters as opposed to reverse osmosis, where the filtration is much more refined, but it also takes away some of the minerals that are important. Okay. And also quality of the water in different areas is different. So you do need to filtrate because of chemicals, pesticides, impurities. I hope that I will get this message across. Avoid prescription diets for crystals. Number one, they may work for crystals by acidifying the urine or doing some other tricks, but they will seriously damage your dog on the nutritional level. If I am to feed my dog brewer's rice and chicken byproduct meal and pork fat and corn gluten meal and dried egg product and calcium sulfate, this is the kind of example of an ingredient list for crystal and stone diets. Just the first ingredient, arsenic. Rice is full of arsenic, and we are very concerned about arsenic and eating too much rice. I've seen this in our hair testing. When we do hair testing in dogs, I've seen dogs on rice having high arsenic. But generally, this is not a species appropriate diet, meaning your dogs would not eat this kind of food if you release them, or canines of any kind, coyotes and wolves. They would not eat this kind of diet. They would not eat corn. They would not eat brewer's rice. And it's just wrong. I will not name any particular brands because it's one of my policies or one of my rules. However, I still would like to have a really open debate and conversation with some of the people who formulate these diets. I have no idea how they can actually release anything like this. And what I've seen in practice is that these diets may, as I said, address some of these crystals, but they make dogs sick and unwell and depleted and living shorter lives. And I dare to say that because I've been in practice for 30 years and I've seen this. So avoid prescription diets. It may be a little bit of a battle. Obviously, you're the decision maker. I'm not necessarily saying that whatever I'm suggesting here you have to do. But I'm saying that you may want to give it a try if it makes sense. We have a recipe maker. Some time ago, our community requested a tool to make recipes. Actually, they wanted me to make recipes, and I really don't like writing cookbooks. So I just decided to make a tool that is useful to make recipes. So you can actually go wild and crazy with it and choose all sorts of different meats and vegetables and make really good balanced recipes, because many people worry that their dog's food would not be balanced. I'll kind of show you how it works on a video. I hope it's going to play. I just played this morning a little bit, and you can click on the different vegetables and select them, and then you can click on the meats as well. You can also see, I'm selecting green peas, and then I'm clicking on garlic and see why it's yellow. Well, yellow, it means that you can get small amounts, but not too large, because it's an onion family. But I've never seen garlic causing serious problems in dogs if you give a little bit in treats or food. You can see I'm clicking on kale, and there's a little note that it is goitrogenic, but I, again, have not seen that in practice, and I think that there are so many benefits of kale that I do recommend and give it. So, and then there are some ingredients that he should not be giving, either toxic or the ones that he should not be giving. So that's the recipe maker. It's kind of cool that I'm doing nothing with my mouse, and it's actually the video is playing. But you can see, you can get different information on the recipe maker. We put our heart and soul in it, and it is free. And it will also give you an idea of what supplements your dog should get. And we are in the business of making supplements, and it happened coincidentally. It happened by me seeing that depletion of nutrients is a serious cause of disease, and it was much easier to correct and adjust than other areas of healing. So I thought, why don't I just go for something simple? So then I started using products of other companies, and I wasn't really happy with the results. And I learned more about nutraceuticals and vitamins and how some of them are manufactured chemically and from cold and crude oil. So I started making fermented products. I started making products that are basically, that I'm not afraid to give my own dog and also take myself. Now we're going to be launching a human line, because so many dog lovers have been taking our dog products that I just finally said, we have to do something about it. I just think that we need to divide them. So we will sometimes in 2021, but the recipe maker will give you an idea what supplements to give. There are 4 essential nutrients that I usually suggest. There are mineral and amino acids, multivitamin with organ support, then probiotics, which are good for the immune system and also immunity for the preventing bladder infections. So that's super important. And omega oils that are really good for inflammatory, anti-inflammatory effect, repair of cells, and also tissue like mucosa, like bladder mucosa or kidneys. Super important for protecting kidneys. And the liver tune is actually one of the darlings for the crystal and stone prevention, because as you know, liver function is super important for preventing stones and crystals. Now, I mentioned that a few minutes ago. So, and I'm not sharing screen again. I'll show you actually the little lineup. I thought I was showing screen. So I just go back. So these are the 4 essentials, and this is the liver tune. I usually use the liver tune every 6 months for Pax and myself. And if you have a dog with crystals or stones, I would recommend giving this product on an ongoing basis until the crystals disappear, and then go back to every 6 months. Did you see the video, Alicia?
Yes, the video was visible. Mm-hmm.
Great. So any foods to avoid, of course, processed food, and also the vegetables or plants that I just mentioned here. Preventing infections, actually, preventing urinary tract infections is super important. Again, with diet, strengthening the immune system and the body. Also, correcting nutrient deficiencies. And interestingly enough, there is a connection between the energy flow to the lumbar area, the backbone of your dog, the lumbar, and the sacral region. It energetically supplies the bladder and also the kidneys. And when there's depletion or some sort of injury to that area, the bladder or the kidneys may be weakened and therefore more prone to infection and dysfunction, and maybe even urinary stones. So that's super important to remember. Now, there's really cool substance that affects the metabolism of bacteria, and that is mannose, D-mannose. D-mannose is a simple sugar, And it is used in preventing urinary tract infections, mainly in people, but also in dogs. And here is a little dosing chart. As I said, D-mannose is a simple sugar, but it is not like the regular sugar, like fructose or saccharides. It's slightly different. And as I said, it affects the metabolism of bacteria and it prevents it from growing. So it's really great. The next ingredient that you can use if your dog is prone to urinary tract infections is cranberry extract. And here's the dosing chart. I'm going to ask actually Alicia and Judith not to share our urinary stone blog because I actually want to correct it. I want to rewrite it in the next few days. So please don't share it. Go according to what I'm saying here because it's much more updated and current. So this is the dose. You can take a screenshot, or if not, we can also post it. Judith may take a screenshot and you can post it, Judith, in the discussion. And hi, Judith, by the way. Judith is in the background. She's not on the video, similar to Alicia, but we are working in a team effort here. So again, you can see here that the lumbar area is adjacent to the kidneys, to the left, the red area on the left, and also the bladder, the sacrolumbar area. So once again, if you have a weakness of the spine here, it will affect the urinary tract, believe it or not. This is one of the reasons, and this is actually off topic a little bit, but this is one of the reasons that I believe causes prostate problems in men and sometimes prostate cancer. If men have lower lumbar pain, it does need to be addressed. If it's not addressed, it actually leads to weakening of the urinary tract and prostate. So if you do have husbands, or if you guys are watching, make sure that you address your lower back pain because it's super important for your prostate and urinary tract health. And of course, it's also important for our canine friends too. I love how human and canine care and health intertwine. Dogs taught me so much about my own health. It's crazy. So what you need to do in order to prevent crystals and stones is to actually improve general health. There is no other way. That is the most important and effective way to go. The treatments or addressing urinary stones and bladder stones are relatively kind of general, with the exception of some of the procedures that have to be used when it is when we discover that our dog has crystals or stones, and I'll be talking about that in the next little while. There's also one more thing that I wanted to mention, and that is nutritional status. You can actually run hair key test, which is a very detailed hair analysis. I love hair key test, and I run it myself on my own hair. I have to usually collect for a little longer time, but it is really effective and very inexpensive way to determine your dog's nutritional status, because sometimes hypercalcemia or some elevation of minerals can cause crystals as well. So if your dog has crystals, you may want to collect hair. It's actually really simple. You can go to our website and get the little instruction how to collect the hair and how to send it to us, and we'll send you results back. It is done by plasma induction method, meaning that the hair is washed and then dissolved into plasma, and then there is a very accurate counter that counts the atoms of the different elements or toxins and heavy metals. You can see this dog, for example, had really, really high mercury. I erase the name of the patient, of course, for confidentiality, but you can see that the mercury here is through the roof. The normal range would be cut off right here at the white line. Okay, so how do you address the sacrolumbar region? Physiotherapy, osteopathy, acupuncture, massage, all those can be done. But it is also super important, and I know that Judith will post a link to a blog on that. It is super important to address exercise. I see some dogs injured their lumbar area by excessive sprinting in the park, retrieving balls for 30 minutes, 45 minutes, an hour, going all crazy. Dogs in nature are not sprinters for like long time sprinters. They would sprint for 1 minute, 30 seconds, 2 minutes, and that's it. I got a really good demo just about 2 days ago when I took Sky to Sky. I do this all the time. Took Pax to a park nearby the Park Castle. Some of you may have seen the pictures, and if not, you can actually look on our Facebook page. It's really beautiful there. But suddenly I see Pax or hear Pax yapping, and 2 seconds later, there was a rabbit running my way, and Pax is running my way, and Pax is chasing this jackrabbit, like this big rabbit, in the park, and I'm trying to call him back, and he's not hearing me. And I'm thinking, oh my goodness, like he's gonna catch this rabbit because he was like this close. And I'm calling Pax and thinking how ridiculous it is that I'm actually trying to prevent him do what dogs would normally do in nature, but it was just like an instinct, and I didn't want the rabbit to die. It was cute. So anyway, finally I called him off, but it was really close. So it took about a minute, maybe minute and a half, not more than that. And crazy enough, and I'd say Pax is powered by Greenman. That's why he almost caught the rabbit. The rabbit looked so tired. He wasn't on Greenman or something. I'm just joking. It's a joke. But of course, minerals and nutrients are important. And it makes me super happy to actually see Pax in such good health. And, when I got a puppy, when he was a puppy, I was actually, I confess, I was super nervous because I was thinking, I know it works, but it would be a real tragedy if my dog didn't grow strong and well, right? So I was super nervous, and he's just really, really well. So it makes me happy. Anyway, so how do we address stones? How do we get rid of stones when they're there? Well, first, you really need to make sure that your vet does a double duty in checking and making sure that this is not a false diagnosis, okay? So that's the first thing. And the second, if your dog is diagnosed with stones, especially with kidneys, but also with bladder, the attempt should be to dissolve them or monitor if your dog is not symptomatic, right? If your dog is not symptomatic and the bladder stone, let's say, is large and there's no symptoms, you don't want to do a surgery. You don't want to put your dog through procedures. And you should attempt to dissolve them by the measures that I just introduced to you, by changing diet, acidifying or alkalizing urine, depending on what crystals there are, and also finely tuning your dog's liver and all what I just said. I don't want to repeat myself too much. So if your dog doesn't show symptoms, it's better to monitor and try to dissolve the crystals. And if there are the ones that do not dissolve very well, like calcium oxalate, you may just want to monitor. One of the methods that we use is hydropropulsion. That's a fancy name for flushing crystals out. This method is used in dogs and cats. And basically you introduce a catheter, and then you try to kind of dilate the urethra enough to get a flow of the urine, outflow of the urine. I'm going to talk cats because this is really common in cats. They get blocked from processed food and also from early neutering when their urethra is really small. I have someone knocking at the door. Taxi, hi. We're talking about you, little monkey. I'm going to do a little break, little fax break. Oh my goodness. Oh, we cuddle you guys here so often. Oh my goodness. Oh, I would cuddle him all the time. Did you have your bone? Did you have your bone? Was it good? Oh my goodness. I gave him a bone. I gave him an oxtail. So he's really mellow. Hopefully he's not gonna be bugging me. I sometimes act like his bellman. Of course he is. Sorry, you guys. You can see that I'm a crazy dog person too, right? Alicia, you may need to entertain the audience here. Anyway, so hydropropulsion. Basically, what happens? You try to dilate the urethra, by catheter and flushing the water in, and as a result, it actually flushes back out. Okay, so that's how we unblock cats. You can also do that with endoscopy. If your dog has a large enough urethra, that can be done with an endoscope and doing the same thing. Now, the following method is called lithotripsy, and I will show you a little chart here. Lithotripsy is basically an ultrasonic crashing of the stone. So if there is a large bladder stone or kidney stone that causes problems, discomfort, infections, pain, they have to be obviously dealt with and addressed. It can be done by ultrasound shock waves, and it can be done internally endoscopically or externally as well. Okay, it also can be done by laser. Laser can also crash stones, but that would be endoscopic and internal. In humans, what can be done? It's they call it extracorporeal lithotripsy, meaning that they put you on the table and they kind of send very targeted shock waves to the particular area where the stone is. And it can be crashed and then easily passed, or sometimes easily passed. So that's one of the methods that can be used, but it may not be available in your area. It's still relatively rare method for dogs, but obviously much less traumatic. I am not in favor of doing kidney surgeries or bladder surgeries if there are no symptoms. I just emphasize this because you really need to have a discussion with your vet if your dog has stones. Is this necessary? My dog has no symptoms, or my dog has symptoms. Let's try to dissolve them, or let's try to crash them. Let's not do surgery. This should be the last resort. I have one really cool picture here. I actually was watching a video this morning, and you can find it on YouTube. They actually insert this endoscope and into the bladder, and then they kind of poke the stone with a device that is very similar to the ultrasonic scaler that your dental hygienists use. And they poke it until it crashes. And then they take this little forceps and they remove the stone and the fragments of the stone. So it's really cool. There's also another method that can be done, and that is intra-abdominal, actually. When you see that there are bladder stones, you can actually use a little basket that you insert through the abdominal wall in the bladder and remove them. Or you can go in the urethra as well with the endoscope. I'm sorry, I actually have to correct myself. The endoscope goes through the urinary tract, and the abdominal incision is made only for inflation of the abdomen. But I'm not an expert in this particular procedure, so I reserve the right to a little bit of an error here because it is not my expertise. There's so much to learn, you guys, all the time. But just remember that the stone can also be grabbed endoscopically with a little basket or crashed with the laser or the ultrasound. That is important. Now, if there is a blockage of the tube, the ureter, the tube between the kidney and the bladder, that can cause hydronephrosis. Hydronephrosis is basically a term for fluid buildup in the kidneys, and it can really damage the kidney tissue. It's super important to address a urinary stone that got stuck in the ureter from the kidney to the bladder, on the way from the kidney to the bladder. It's super important to deal with it as well, either endoscopically or externally with crashing the stone. Now, surgically, obviously, it can be done, but the trauma to the ureter can be quite severe, and it is usually not the best way to go. So, as I said, surgery is the last resort. If you need to go for surgery because you don't have the methods available that I just mentioned, or your dog is critical and something needs to be done right away, if the ureter gets obstructed or both of them get obstructed, that can be really very, very serious. It's good to have a conversation with your vet. It's good to prevent crystal formation. So make sure that you address your dog's dietary needs, that you optimize your dog's metabolism, you support your dog's liver and immune system. And I've suggested all those steps in this presentation. So now we have questions. I'm curious to see what questions will come up. And Alicia, it's your turn.
Thank you. That was amazing information. And we do have some questions. So thank you to the community for pitching in. The first question is from Rosie. She asks, when you say carbon filter, is that a Brita filter? Do you have a favorite type of product for filtering water?
That's a really interesting question. I don't mean Brita filter. And again, a brand was brought up. I will suggest to you to do a little bit of research of the efficiency of the different filters to choose the right one. There are different brands in different regions, countries, areas. So I'm not going to recommend a particular filter, but what I do recommend is a filter that is attached to your water system, at least in your kitchen or where you take the drinking water. And I usually use, there's usually several levels, right? There is like 2 or 3. So I'm not a filter expert, but I know that I usually do review, and there is a lot of information online, which ones are good and which ones are less good. But it should not be a reverse osmosis. Reverse osmosis removes too much from the water. It removes minerals, which is not ideal.
Thank you. And the next question is from Dorinda. She says, what support can be offered to a dog that already has kidney stones? Is it different than support for stones in the urinary tract?
That's a really good question. I love your questions, you guys. So the urinary tract includes kidneys. Urinary tract is from the kidneys all the way down to the bladder and the urethra. The support is kind of the same. If your dog has a particular type of crystals, I'll give you an example. If your dog has struvite crystals, for example, they usually appear in alkaline urine. So your goal, your objective would be to acidify urine. And to be honest, you will acidify urine to pH of 6 or 6.5. 7 is neutral, over 7 is alkaline. You will acidify urine with raw or cooked meat diet. And I would take a little pH strip and I would measure your dog's urine pH. And if your dog's urine is less than 7, 6.5 or 6, great. And kind of achieve that objective. But the different types of stones require different pH and metabolic support. So this is what I usually suggest. And I almost, if I didn't have an internet failure this morning, I would look up a case that was really awesome. This dog was lived in Nevada. I remember that. And his name was Rocky, out of all names. And he had chronic recurrent urinary tract stones, surgeries, like 3 surgeries, really lovely dog, lovely client. And it was heartbreaking to see. And we were working with her, just kind of like improve his general health and his diet. And despite us giving even mineral support, despite us giving different supplements, one would think, if dog has crystals, you would not give minerals. No, it's not true, because you have to actually balance the spectrum. If it's out of balance, that's when crystals form. So again, focus on the general health, focus what I addressed here, and see what is left. And if there is, if the stone is still there and it's causing problems, obviously you'll have to talk to your veterinarian. If it's not causing problems, you may just want to monitor once in a while, maybe once a year, do an ultrasound and see where it is, and really be on guard. If your dog is being dog sat by someone else, say, he has stones, make sure that you monitor for urination, make sure that, that he or she is safe. That's all.
Thank you. And Karen Mitchell's question actually follows up to what you were just talking about. Her question is, what is the easiest way to get a urine sample at home to test pH?
For some dogs, it can be really, really hard. You know what I'd suggest? You know how you have these measuring cups sometimes, like those little flat ones, or spoons or something, or a little pan, not too big. Your dog may be totally freaked out by you coming with the pan. But something like a ladle. Ladle is actually perfect. That's what I wanted to say. Ladle is amazing. Really nice and clean ladle. Perfect. And you can then get different sizes. For a little Chihuahua, get a little mini ladle, and for a Great Dane, get a big ladle, and then test it. But make sure that it's really well rinsed and washed, because if we have some sort of pasta cells left over, that may affect the pH.
Thanks so much. And the next question is from Kim Hudson. Her question is, can you speak to calcium and zinc supplements? She doesn't like giving calcium carbonate powder. And I know that this was mentioned briefly when we were going through the slideshow, but if we can circle back to what sort of a role supplements play when it comes to these stones.
Yeah. So it really depends. I don't want dogs that have, that have excess minerals getting additional calcium. So I think that the only way to measure really like long-term levels of calcium is actually using the hair test as opposed to blood test, because blood test is a very momentary kind of measurement. The hair encapsulates the minerals from plasma as it grows, and you get longer-term kind of levels. That is much more accurate for you to know my dog is long-term depleted or not. I would recommend full spectrum mineral supplementation to dogs that do not have high calcium and have low or normal levels, because you cannot really know everything, every little single tiny detail about your dog's metabolism, and that's why we need to use the full spectrum. If there is, let's say, even something like selenium or iron missing, or it can really create a metabolic imbalance that can lead to crystal formation. So, there's so many different factors that play a role, like that is super important. Now, when it comes to zinc, I have not seen dogs being zinc deficient often. Therefore, I don't have much experience with additional zinc supplementation. But when we use Green Min, our dogs usually get sufficient amount of zinc.
Excellent, thank you. And if we have time for a couple more questions,
another
question that came up was to do with the difference between male dogs and female dogs. Is it riskier for male dogs to try to dissolve the struvite crystals, given that they have potentially a narrower urethra? Could it cause the blockage? Have you seen anything where you would treat females and male dogs differently?
Number one, if your vet suspects stones, it's really good to do an ultrasound, because sometimes struvite crystals can be radiolucent, meaning transparent to the X-ray. Sometimes they're moderately radiopaque, meaning that they show on the X-ray sometimes, and sometimes they're hard to see. It all depends on the size of the stones as well. If the stones are really large, then they're unlikely to pass in the urethra. But if you're dissolving them, that at a certain point they can start passing, and you would see that your dog is in discomfort. But urinary tract blockage is not as common in dogs as it is in cats. So I would say that it's really safe, and that would be the method of choice to try to address, let's say, acidify the urine in the case of struvite crystals, and measure the pH and monitor for any signs of discomfort. But it is not, you would recognize it within a few hours that your dog has problems to pee. Definitely much easier to pass it in female dogs, but female dogs may have more of a propensity to urinary tract infections. So you may want to actually really check for urinary tract infections, and maybe start giving mannose and cranberry extract. I remember Sky's sister, Peggy, having urinary tract infections. As a spayed female, her vulva was smaller and was kind of embedded, and she, the fold was just kind of causing bacterial burden, and she had urinary tract infections. And when female dogs get older, their sphincter is not as tight, and as a result, the bacteria has a little freer access to the bladder. So a slightly different anatomy. Unneutered dogs obviously may have prostate problems as well, but we're not going to get in the question of neutering or not neutering, because that's another topic. And I don't really know the straightforward answer about that. I'm still undecided what is better. There are pros and cons, and you just have to read and decide what is better for your dog. When it comes to population control, that's a different story. But I derailed, and I'm going to go back to Alicia.
Thank you for answering that. That was brilliant. A follow-up question is from, let's see, Dorinda. Dorinda asks, what would be an observable sign that a dog has a stone obstruction? You just mentioned, if a dog has maybe urinary tract infection, you can maybe visibly see that they're having trouble peeing or they're in pain. But what does that look like if they've potentially got crystals or stones? What can dog lovers look out for?
Crystals and stones they're sometimes undetected if they don't cause problems, but sometimes they're detected coincidentally on urine sample analysis. In that case, you'll do a recheck, I know now, especially if the sample was collected out at home, or if it sat in the lab or in the fridge for a longer time. Sometimes blood in urine, peeing often, having irritated bladder. Signs of discomfort, licking around the vulva or the penis. Those would be the signs. I think that I always rest assured that dog lovers just simply know when there's something wrong. I don't doubt that most of you, unless you're just kind of on the computer and not noticing your dog at all the time, and I don't think you are, most of you will know that there's something wrong. And obviously preventive examinations, get the urine sample done. If your vet says, your dog is 5-year-old, you don't need to have blood tests done and urine tests done, why not? I actually run it in packs twice a year. I am curious, and I also want to make sure. I think it's a little overboard, but because Pax goes to Hawaii and he travels, I want to make sure that he doesn't have heartworm. So I usually run tests for heartworm, and then I just run chemistry and complete blood cell count and urine just to make sure that he's fine. And if you're wondering about heartworm prevention, which I just touched, you can find an article on my website. You guys, there's so much information on the website. I'm always surprised how I don't really know who wrote it. I wrote it actually, but I sometimes am really blown away that I was able to. I'm probably sleep writing or something. But anyway, there's a lot of information. If you just want to Google something, let's see, urinary stones, Peter Dobias, you will get a result. Also on our website, there's tons of information. Subscribe to the newsletter, because it's really like we publish, and I publish so much information. Just to let those of you who are new to our community, how our company functions is relatively simple. When I was in the veterinary clinic and when I worked in practice, I was really frustrated that the same problems keep coming back and back over and over in different dogs. And I decided to first slow down in the practice and start working on writing and working online and teach you dog lovers how to empower you and how to make you as smart as possible so you can protect your dogs and help them. And that resulted also in the supplement formulation, because I needed them for keeping dogs healthy. And I also love formulating. I love nutrition. And I am very grateful that it turned out well. And now what we do, we provide free advice to anyone who needs it and wants it. And those of you who purchase our supplements basically help the greater good. That's how we sponsor and finance basically the free help that we offer and provide. Some people are upset. Sometimes people say, he's got good information, but he pushes his supplements. Well, I don't really know any other way to keep our dogs healthy. And I basically suggest what I do for my beloved packs, and I want to share it. And ultimately there's a freedom of choice. So, you're always welcome here, no matter whether you're our customers or not. So thank you so much for being here. Alicia, do you have anything to add?
No, I think that we covered some great questions. And for anyone that has posted a comment or question that we haven't gotten to, we'll definitely circle back to that as the day progresses. But yeah, thank you everyone for your participation.
Awesome. Thank you so much. Hi from Prague and Whistler, BC. And actually, Judith is in Florida. She's our team member from Florida. So hi, Judith.
Absolutely.
I know you're there
have
somewhere.
a global
You're hiding
team.
on us. Take care. Bye-bye.